KBOI News Time 821. Join on the phone, Dr. Mark Hiatt. Dr. Mark Hiatt, welcome. I'm Nate Shellman, by the way. I'm filling in for Chris Walton. I might as well introduce myself.
Morning, Doc.
Good morning. Yes, good morning, Nate and Paul J.
Talking about birth control, does it have any effect on the risk of cancer?
You know, it really does. There's been this major study, Nate. It involved about 2 million Danish women over more than a decade, and it actually discovered that women who use birth control pills that contain these low doses of hormones actually increases the risk of breast cancer in women.
So how much higher is the risk of developing cancer?
About 20% higher. That is, the risk of breast cancer is about 20% higher for women who are currently using or had recently used these hormonal contraceptives than among those who had never used them.
Now, the longer somebody uses it, does the risk increase?
It does. It was found in the study that the increased risk rose from about 20 to 40%.
All right. Dr. Mark Hiatt joining us here on 670 KBOI.
Doc, the risk of cancer increased the longer a woman used hormonal birth control. Now, does this mean that the women who have been using birth control for a while should stop?
Well, that is a good question, Paul, and I wouldn't suggest that women stop it without consulting their physician. There are risks and benefits to using hormonal contraception, and this study just points out that there is a risk that women should keep in mind as they consider whether or not to continue using that form of contraception.
Dr. Mark Hiatt joining us here on 670 KBOI. Dr. Hiatt, in my personal life with my parents, they're both in different stages of Alzheimer's, and it affects many people. How is that impact expected to change as we move along?
You know, Nate, a lot of Americans are affected by Alzheimer's disease. It's expected that this debilitating brain disease or some mild cognitive impairment, which could be a precursor to Alzheimer's, it's expected that really the number of Americans affected will more than double by 2060. It's thought that as many as 15 million Americans will have this disease compared to only 6 million currently.
What causes Alzheimer's?
Paul J., we're not really sure, but we suspect that the culprit is a buildup of these abnormal proteins, and they just accumulate in your brain and cause nerve cells to die in this progressive degenerative disease of the brain. And so as these brain cells die, the functions they provide are lost.
Dr. Hiatt, what are the symptoms? What should people look out for?
You know, early on, and this is characteristic of Alzheimer's disease, early on, folks experience a loss of short-term memory. They just can't recall things, and then they become disoriented, may have behavioral changes as a result. And then later on in the course of this progressive degenerative disease of the brain, they may experience more severe memory loss, even such that they may lose their ability to walk, eat, or even drink.
So what is being done right now to combat Alzheimer's? What are they looking at?
You know, first, Paul J., we're getting a better understanding of what causes Alzheimer's, how it can be detected earlier on. And then just in the past 15 years, the bulk of the new discoveries with respect to treatment have been occurring. And I'm really optimistic about the horizon, that there will be ways that we can treat the disease, really understanding its underlying mechanism.
Dr. Mark Hiatt, our medical moment, thank you so much for the time, sir.
Thank you.